Hello and welcome to this short introduction and overview of the HRCI HRB Joint Funding Scheme. What is the HRCI HRB Joint Funding Scheme? It's a unique scheme that brings together members of HRCI and the HRB to fund patient-focused research. It provides co-funding of research projects of key relevance to member charities. The HRB provides dedicated funding and primary grant management responsibility, and HRCI is the first point of contact for the scheme and manages charity involvement. What makes the HRCI HRB Joint Funding Scheme unique? It has no known international parallels, and it has a good success rate, with 24% of projects submitted to charities ultimately approved for funding in 2024. It's open to almost all types of research, and it's particularly beneficial for rare disease research. It has strong PPI, and it was the first HRB funding scheme to include PPI reviewers on the review panel, and at heart it promotes patient-focused research. So how is the scheme funded? The HRB contributes 50% of the cost of the project, and the charity contributes another 50%. And it should be noted that the HRB's contribution is paid directly to the relevant research institution. In the case of very small charities whose revenue and reserves are under 150,000, the HRB will contribute 75% of the cost of the project. The HRB makes a €1 million annual contribution to projects funded under the scheme. Each award is worth up to 300,000, and that is the combined charity and HRB funding for projects from 12 up to 36 months. Each charity is permitted to submit up to 3 projects to the HRB, as well as a +1. A +1 refers to the situation where a charity may receive more highly rated applications than it can afford to fund. It may submit, in this case, 1 additional application more than it can afford to fund to the HRB. For example, the charity might have 3 applications with a high score, but only have funding for 2. In this scenario, should all submitted applications be recommended for funding at joint selection panel stage, the lowest ranking application will not be funded. Eligible costs under the scheme include personnel costs excluding tenured staff, student stipends and fees, but this excludes PhD students, direct running costs, PPI costs, and dissemination costs. Where funded personnel are registering for a master's degree, a letter of support from the relevant higher education institution is required. The HRB funding purse and funding criteria are subject to HRB board approval, which was granted in June 2025. Almost all types of research are supported by the Joint Funding Scheme, almost everything that's relevant to patients. This includes patient-oriented research, health services research, and population health research. What's not funded under the scheme? Applications planning to include PhD candidates are not funded, as the maximum length of projects funded in this scheme is not long enough to allow for full training of a PhD candidate. Applications which are not primarily research, such as literature reviews, technology development, infrastructure, or health services. Studies evaluating full-scale definitive interventions to provide high-quality evidence on the efficacy, effectiveness, cost, and broad impact of the intervention, and standalone feasibility studies conducted in preparation for a future definitive intervention are not funded, and this includes randomized controlled trials. Applications not considered appropriate for ethical reasons, such as applicants receiving research grants from the tobacco industry or alcohol industry, or research creating humans for the purpose of stem cell procurement, and applications which are solely or predominantly health service developments or implementation of an intervention without a predominant research element. The HRB will not fund the cost of providing the service or intervention itself, only a research component. However, applicants can propose work to develop a healthcare intervention. Such work may include some initial testing of the intervention in order to generate proof of concept data and thus have the basis for developing a feasibility study. This would mean that applicants could then apply to the HRB or another funder to support a feasibility study as a next step. In such cases, applicants must consult with the appropriate clinical research infrastructure supports, such as clinical research facilities, to ensure that the work done will allow them to develop a feasibility study subsequent to the HRB charity-funded research. And just a note on developing supporting evidence for a proposed study, it is expected that evidence supporting the case for a proposed study has been systematically gathered. So how does the scheme work? First of all, charities open calls either for expressions of interest or EOIs or for full applications. If a charity is doing an EOI phase, they will then undertake an internal shortlisting process to decide which EOIs to invite for full applications. After this, applicants submit their full applications to the HRB via its electronic grants management system, GEMS, and charities have access to these applications while they are being worked on and once they are submitted. Charities then will identify peer reviewers for each application, and each application requires 3 international peer reviewers. The peer reviews and the applicant response to the peer reviews are then conducted via GEMS, and they're provided to the charity to allow the charity to finally shortlist applications that they wish to see submitted to the HRB's Joint Selection Panel. The applications are considered at the Joint Selection Panel. They are assessed by scientific and PPI reviewers, and they are given a scientific score and a PPI rating. Finally, a list of fundable or approved projects goes to the HRB board, who approves successful projects, and then contracts are issued. So how do you apply to the Joint Funding Scheme? Well, if the charity runs an expression of interest phase, these must be made on or before their set closing dates, and this varies according to the individual charity, and more details will be available on their calls. Full applications must then be made via GEMS, the HRB's grants management system, on or before the 26th of November 2025, although some charities may require an earlier deadline. The next round of the scheme is open and has been open since July 2025, and it runs every 2 years. Open calls and links to the relevant charity web pages are hosted on HRCI's website www.hrci.ie. HRCI also sends regular updates on open calls to different higher education institution research offices. To be eligible to apply to the Joint Funding Scheme, lead applicants must either hold a post that covers the duration of the award in a recognised research institution as an independent investigator, or be a contract researcher recognised by the research institution, or be an individual who will be recognised as a contract researcher by the research institution. The lead applicant's contract must cover the duration of the award. Lead applicants must have at least 3 peer-reviewed publications and, if applicable, other outputs demonstrating impact in their field, and at least 1 peer-reviewed research grant as lead applicant or co-applicant. Only 1 application per lead applicant will be considered. Lead applicants can be based outside Ireland in specific circumstances, such as in the case of rare diseases where there may not be a research presence in Ireland. When considering partnering with HRCI member charities, researchers should think about building partnerships with charities early, and it is important to familiarise yourself with the relevant charity's strategy and objectives. Patient and public involvement in research is integral to the joint funding scheme, and there are specific PPI questions in the application form. These are subject to change, but this is an example from the application form from the last round of the joint funding scheme. This asks, please describe all PPI at each stage of the research cycle, that is identifying and prioritizing the research question, design, conduct, analysis, oversight, and dissemination. And for each stage, include the purpose of the involvement and how PPI has influenced or changed planned work. This is to avoid tokenism or tick box exercise and to make sure researchers understand the purpose and impact of their proposed PPI. The review panel meeting includes a review of PPI in applications and applies a PPI rating, a correction to the scientific consensus score, which can make a material difference to the outcome of an application. So it is important to think about PPI from the very start. To help you develop your PPI approach, we have produced case studies of excellence in PPI and applications to the joint funding scheme, and the link is on this slide. Charities themselves are skilled in PPI and may be able to advise and support you. HRCI has also got resources on our website such as the PPI toolkit and videos of successful past projects, and the local PPI Ignite teams in the various higher education institutions can also help and advise you. So this is the timeline for the 2025-2026 round of the joint funding scheme. Charities calls open from July 2025 onwards. The HRB opens GEMS to receive full applications on the 1st of September 2025. The deadline for receipt of full applications on GEMS is the 26th of November 2025 at 1 p.m. The deadline for receiving international peer reviews for each application is the 26th of February 2026. The applicant response and final charity shortlisting phases run from late February through to April 2026. The Joint Selection Panel receive applications to review these through April and May 2026, with the Joint Selection Panel review meeting scheduled for late May 2026. The successful projects are brought before the HRB board, who approve in late June 2026. Applicants are notified of the outcome in July 2026, and contracting initiates in July and runs through September 2026. So a few final tips to help you if you wish to apply to this round of the joint funding scheme. It's important to be proactive now, to build connections with charities relevant to your field, and to make sure that your research lines up with the priorities of the charity. Don't continue unless you're serious about patient or public benefit. Your priorities may be different from charities. Start giving thought to PPI now and line up an experienced research, design and statistics expert if that's appropriate for your research. And finally, keep an eye on the HRCI website and our social media feeds for updates on open calls. You can find further information on the joint funding scheme on our website, www.hrci.ie, or on the HRB's website, www.hrb.ie, and where they will shortly update their joint funding scheme page. If you have any queries, you can contact me, Dr. Sarah Delaney. I'm the Research Support Manager with HRCI, and you can email me on sarah@hrci.ie. Thanks very much for watching this video. I really hope it was useful for you.